Christmas Eve is 1 week from tomorrow. Millions of families preparing for the holidays, and now we find ourselves dealing with this new variant spreading very quickly. COVID cases surging to the highest point in a year now, and tonight what they're already seeing in New York City already. Some Broadway shows shutting down, some restaurants reportedly closing because their workers are now sick. And that other major news tonight, a CDC panel now recommending, if you haven't had the vaccine yet, to choose the Pfizer or Moderna vaccine over Johnson & Johnson if possible because of concern over very rare blood clots. Tonight, this highly transmissible Omicron variant sweeping across the country, now in 39 states and Washington, D.C. Dr. Anthony Fauci telling us cases are now doubling every 2 to 3 days. Long lines for testing here in New York City. The health commissioner saying cases have tripled in just a month, averaging nearly 3,800 confirmed and suspected cases every day, calling the numbers tonight, quote, alarming. This is being seen across the country. From Orlando, Florida tonight, they have found Omicron in nearly 100% of wastewater samples tested this week. Samples tested just a week ago, authorities say, did not detect the variant. Dr. Jha is here to answer your questions. I know a lot of concern, especially with the holidays approaching. But first, the news on Johnson & Johnson, the vaccine, and this new variant moving quickly. ABC's Stephanie Ramos leading us off tonight.
Tonight, a CDC panel voting unanimously to recommend that going forward, Americans who have a choice should get Pfizer or Moderna vaccines over Johnson & Johnson after a review of rare blood clots linked to the vaccine.
We have 15 yeses, 0 nos.
9 people have died from thrombosis out of 17 million shots. The blood clots were more common in women in their 30s and 40s.
It's very clear that the mRNA vaccines are just slightly more effective and slightly more safe. So it makes absolute sense that CDC would preferentially recommend the Moderna and Pfizer vaccines.
It comes as health officials are pleading with Americans to get vaccinated and boosted, with the Omicron variant now spiking across 39 states and D.C., cases doubling every 2 to 3 days.
It is inevitable when you look at the pace of the infections now that things will get worse as we go into the depth of the winter. And with Omicron breathing down our back, things could get really bad, particularly for the unvaccinated.
Authorities are urging caution with a new study making headlines tonight that, if true, may partially explain why Omicron is so transmissible. Researchers at the University of Hong Kong estimate that the Omicron virus could multiply 70 times faster in the bronchial tubes than the Delta variant. The study has not yet been made public for review. Today, long lines for testing. New York City bracing itself with a spike in numbers. Nearly 3,800 new COVID cases every day, compared to 2,300 just a week ago.
It is clear that the Omicron variant is here in New York City in full force.
The city planning to distribute home COVID tests and KN95 masks, urging residents to upgrade or double mask. COVID cases forcing Broadway shows like the Tina Turner musical and Hamilton to cancel performances. Even some New York City restaurants closing because too many workers have come down with COVID. An outbreak at Cornell University now topping 1,000 cases, many of them Omicron.
It was definitely a surprise since I am fully vaccinated, but I do realize that that's still a risk, so I was still trying to be cautious.
Tonight, Stanford University, just the latest school to go remote and require booster shots for the spring. And the NFL tightening COVID protocols with mandatory masking and virtual meetings. 70 players testing positive this week or exposed, including Odell Beckham Jr. and Baker Mayfield. In Florida tonight, an eye-opening finding in Orlando. Omicron is already making up nearly 100% of wastewater samples taken this week. It went from 0 to nearly 100% in a week. Today, the president meeting with his COVID response team.
The whole point is Omicron is here. It's going to start to spread much more rapidly at the beginning of the year, and the only real protection is to get your shots.
The CDC now projecting COVID deaths could soar 71% to 15,000 deaths in a week by January 8th. Experts are warning hospitals already overwhelmed by the Delta surge could reach their breaking point.
We literally do not have any ICU beds. We have been running rampant up here.
In Nebraska, hospitals forced to add COVID units to make room for sick patients.
It's been a long day, and now we are telling patients that we can't increase their level of care because we don't have the beds.
In Wisconsin, just 3% of ICU beds are available.
We're stressed, we're burned out, we're exhausted mentally and physically. We want to take care of the patients that come here, but I'm telling you, we're so exhausted and frustrated.
All of those doctors and nurses on the front lines very concerned with what they could be seeing from this new variant in the coming weeks. And Stephanie, we're going to get to Dr. Jha on the Omicron variant, how quickly it's spreading. But before I do have one more question tonight on the CDC panel and their guidance saying to choose Pfizer and Moderna over the Johnson & Johnson vaccine if possible because of concern over these very rare blood clots. The company responding tonight?
Exactly, David. Johnson & Johnson saying they remain confident of its benefit-risk profile of its COVID vaccine. And David, these blood clots are very rare. But given the choice of vaccines, the CDC panel recommended opting for Pfizer or Moderna when possible, but stressed that COVID itself carries a much higher risk of blood clots. This will now be reviewed by the CDC director. David.
All right, Stephanie Ramos with us tonight. Stephanie, thank you. We know many of you at home have a lot of questions, particularly with Christmas Eve, 1 week from tomorrow, families planning get-togethers. And so let's bring in Dr. Ashish Jha, Dean of the Brown University School of Public Health. Dr. Jha, always great to have you with us. And first, let's get right to it. We heard from the CDC already that this new variant, Omicron, is doubling every 2 days or so. It's one thing to hear that from them. It's another thing to start hearing it and seeing it from people in your everyday lives, anecdotally. I'm hearing from a lot of people, family and friends, colleagues, who are seeing this. I'm curious, does this simply underscore just how transmissible this is? And has the speed of this been eye-opening even for you?
Yeah, good evening, David. Thank you for having me back. The speed of this transmission has been eye-opening for all of us. Even in the last week or 10 days, it has moved faster than I expected, and it's spreading quite rapidly across the country.
I wanted to bring up something we just heard late this afternoon from New York City's health commissioner. He said we are seeing a steep rise in cases here in New York City, for example, coupled with the threat of this more contagious Omicron variant. He even goes as far as to say, consider upgrading your mask to a KN95 or KF94 mask. They're signaling here in New York to take this seriously.
Yeah, absolutely, David. This variant is spreading widely. For people who are, I think vaccinated and protected, it's maybe not as much of a problem. But for a lot of other people, I think getting infected could end up getting them sick. So I think we absolutely need to take this very seriously right now.
You bring up vaccinations and people who've been boosted. We're seeing these universities, for example, closing down, going online, hundreds of cases at Cornell alone. There's a second part to this, and you made me think of this. The students had to be vaccinated just to return to school in the first place. We're also hearing of people who've had the booster still getting this. And I bring this up with you because you've been adamant that this doesn't mean the vaccines and boosters aren't working. It actually would appear they are in holding back the severity, at least so far.
Absolutely, David. What we know is that boosters will protect against infections, not perfectly, but whether you've gotten two shots or three, you're much, much better protected against severe illness, hospitalizations, and deaths. And that, at the end of the day, is the thing we care about most.
And one more question. I mentioned this at the top. Christmas Eve, a week from tomorrow. What would you say to families asking? And I know I've talked about this with my own family. If you want to be careful, what should you do? What do you keep in mind? Who should you keep in mind?
Yeah, I think Christmas Eve, Christmas Day, I think it's possible to gather with families safely. The key in my mind is making sure everybody who can be vaccinated is vaccinated, people are boosted. And if there are high-risk people, elderly, others, getting everybody a rapid test can make it that much safer yet, David. So it's a really important season. I think we can get together, but there are ways of doing it safely.
All right, Dr. Jha, very helpful as always. We all have to be careful in these coming days. We sure do appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.